Welcome. Welcome to forpay.org. This is Consumers, Dr. Vingala. Will continue to strive the health issues which are utmost important for all consumers, patients, customers, and everyone. Today's topic, we have spoken about cost of care, access to care, and quality of care. Today's topic is quality. Quality of care starts with quality health insurance. Yes, quality health insurance. Consumer driven, personalized health insurance means easier access to quality care. Easier access to quality care means better treatments. Better treatments means better health. Yes, better health. The Institute of Medicine concluded health insurance is associated with better outcomes for adults with their receipt of appropriate care across range of preventive, chronic, and acute care services, folks. Acute care services. Adults without insurance experience greater declines in health status, die sooner than adults with continuous coverage. They fare better. Patients with insurance definitely fare better. Ripple effects of being uninsured, having poor health, are felt throughout society. Uninsured children have impaired development and poor school performance. Uninsured children are 70% more likely to go without care for common childhood conditions, folks. Common childhood conditions such as asthma, ear infections, sore throats. Uninsured children are 5 times more likely to have unmet need for medical care each year, folks. Uninsured are 33% less likely to get a routine physical exam and 25% less likely to visit a doctor for an illness. Uninsured women are 36% less likely to get a pap smear and 60% less likely to get a mammogram. Uninsured men, 40% less likely to get a prostate examination. Uninsured adults have more absences from work. Yes. More absences from work, more unscheduled sick days, and greater rates of disability. As per the 2004 Kaiser Family Foundation study, they found social costs of the uninsured to exceed more than $125 billion. Consumer-driven personalized health insurance provides specialized treatments for those most in need and improved access to quality of care for all who seek it. All who seek it, yes. Quality of care includes good mental health for individuals and small groups. In 2008, Mental Health Parity and Addiction Equity Act, so-called MHPAEA, abbreviation, MHPAEA, required employers with over 50 employees to cover mental health, same as a physical health. This is as per ERISA law, federal law. Employees and family members enrolled in smaller group plans need the same integrated mental health benefits. One truism exists. One truism exists. If an employer sponsored plan does not include stress management, you can have 100% certain that plan members will have their own stress management program. It is unlikely to be beneficial to a worker's health or productivity. Without a structured stress management program, the most common self-destructive stress reliefs are comfort foods, folks, comfort foods, smoking, alcohol, drugs. It takes away the entire society. Most employers are beginning to understand the work effects of stress and depression. Few employers fully grasp the debilitating impact on families with attention deficit disorder, ADD, post-traumatic stress disorder, PTSD, and other more complex and mental health diagnosis. Mental health diagnosis. Here's the chart, folks. I'm displaying the chart right in front of you. The chart shows the mental health, physical health, and corporate costs are interrelated. Corporate productivity losses. Corporate productivity losses are potentially much higher than any treatment cost, folks. Any treatment costs. Mental health issues are not character weaknesses. They're not character weaknesses like most physical illnesses are. Mental health is a disease and it's treatable, folks. It's treatable. As mental health axiom states, you cannot have a health without a mental health. You cannot have a health without a mental health. Looking at the chart, folks, just take a look at it. Low cost. If a person has frustration, anxiety, low stress, minor depression, that will lead to tobacco use, sleeplessness, cold flu, and blood pressure. And that will lead to increased errors and loss of teaming and presenteeism. Whereas if a person has moderate stress, depression, anger, ADD, and post-traumatic stress, that will lead to hypertension, musculoskeletal, digestive, and gastrointestinal problems that will ultimately lead to unscheduled absences from work, poor morale, relationship conflicts, and loss of productivity. That is a medium cost, folks, for the employer. or the medium cost for the business. What are the high costs? Okay, let's look into it. If there is a high stress, major depression, schizophrenia, bipolar disorder, obsessive compulsive, panic disorder, anorexia, bulimia, that will lead to cardiovascular, cancer, diabetes, asthma, back pain, alcoholism. Ultimately leads to low productivity at work, divorce, a lot of turnovers for employers, early retirement, workman's compensation, and disability. That is a high cost for the businesses over 50 employees. Extra high costs are when there is a violence and suicide. That is an extreme. When there is a violence and a suicide, that will lead to accidents and burns, that will lead to death, work violence, disaster recovery. That is extremely high cost, folks, extremely high cost. So remember, quality of care goes beyond provider credentials and medical results. It, it encompasses timely medical advice, informed options, alternative treatments, and good bedside manners, and more. The bottom line, folks, quality of care is only possible when options to access care is provided through affordable health insurance. I can't emphasize that fact, affordable health insurance. Forpay.org strives to provide through a nonprofit quality of care through affordable health insurance premium, folks. Thank you for listening. If you do like this channel, subscribe, share, and make some comments. I would love to hear from you guys. Thank you, everyone. I love you guys. We will see you in the next episode. Goodbye.